Why are you living in the midst of a lower body pain pandemic, Part 2? This is Part 2 of the information series on the lower back pain pandemic we are experiencing. The World Health Organization have officially christened lower back pain a major cause of disability across all industrialized nations. The WHO have also stated clearly that back pain is the leading cause of work absence throughout the developed world. The 2010 Global Burden of Disease study placed back pain among the 10 most impactful conditions to people's overall well-being in developed countries. In industrialized societies, the lifetime frequency of back pain is estimated at 60 to 70%. Studies in the United Kingdom have revealed back pain as being the leading cause of disability in young adults and attributes 100 million lost work days per year in the UK alone. A survey carried out in Sweden during the 1980s identified back pain as the cause in 21 of their 28 million total lost work days in Sweden per year. The US estimate for the financial cost of back pain to society through people missing work alone is between $100 to $200 billion per year. Even allowing for a few mental health days and hangovers being blamed on back pain, these numbers should have the power to shock. Hip pain and knee pain. In the UK, research indicates the percentage of 65-plus-year-olds reporting hip pain is 19.2%, while the percentage of 65-plus-year-olds reporting knee pain is 32.6%. The percentage suffering both hip or knee pain was 40.7%. General health status scores of elderly people are similar to those of people aged under 65-year-olds in those who aren't living with chronic pain. This shows a correlation between pain and wellness in older adults. A study carried out in the US indicated that a total of 14.3% of participants aged 60+ reported significant hip pain on most days in the 6 weeks leading up to the survey. Knee pain is estimated to affect approximately 25% of all adults, at levels that limit function, mobility and quality of life. From 1991 to 2006, the numbers of total knee replacement in the United Kingdom more than tripled. In the US, the rate of knee replacements among individuals over 65 years increased about eightfold from 1979 to 2002. Ankle pain and ankle sprains. Sprained ankles have been estimated to make up to 30% of injuries seen in sports medicine clinics and are the most common musculoskeletal injury by far. 25,000 Americans a day sprain their ankle, and more than 1 million visit emergency rooms each year because of ankle injuries. Lateral ankle sprain accounts for up to 20% of all sports-related injuries. Indoor and court sports have been shown to carry the highest risk of ankle sprains. UK study estimates 302,000 new ankle sprains and 42,000 new severe ankle sprain patients bad enough to attend emergency departments in the UK every year. A US Army study found that ankle sprains are the most common foot and ankle injury in active duty Army personnel with a rate of 103 sprains per 1,000 persons per year. Approximately 40% of those who suffer an ankle sprain are estimated to experience chronic ankle pain, even after being treated for their initial injury. Studies indicate that ankle sprains are not simply a matter of bad luck. Certain people suffer recurring sprains and many others live their whole life without any ankle sprain. Heel pain and plantar fasciitis. Approximately 1 million doctor's visits per year in US are due to plantar fasciitis. Some literature on plantar fasciitis shows the prevalence rates among a population of runners to be as high as 22%. Heel pain has long been recognized as highly prevalent in the senior population, which impacts approximately 1/3 seniors older than 65 years. There is data that indicates the type of functional issue seen in the feet of plantar fasciitis and heel pain sufferers is associated with poor balance and increased risk of falls. Heel pain is the most common in active people over the age of 40. Osteoarthritis. According to the CDC in the US today, there are an estimated 54 million people living with osteoarthritis. Osteoarthritis is the most common cause of disability in adults globally. The lifetime risk is of developing symptomatic knee osteoarthritis in Western society is 45%. The lifetime risk is of developing hip osteoarthritis with noticeable symptoms is 25%. There are 14 million individuals in the US who have symptomatic knee osteoarthritis at any given time. Nearly 2 million of these are people under the age of 45. The overall rate of osteoarthritis in military service members is 26% higher than the general population. At age 20 to 24, it is twice as high as the general population aged 40 and older. A study in 2012 demonstrated that osteoarthritis was the highest cause of work loss and affected more than 20 million individuals in the US. The estimated cost to the economy is more than $100 billion annually. What I hope that you can sense here is that for there to be this much pain afflicting people who essentially every advantage in life, there is surely something up. Make sure you continue with parts 3, 4 and 5 of this presentation, where I analyze the specifics and causes of lower body pains, and some of the methods we use to help you. In the meantime, if you would like to come and see us for a consultation at City Chiropractic, give us a call now on 0438564446.